Climate change threatens the health and safety of everyone. But some communities have long faced more than their share of the harms from pollution and will suffer more from the impacts of climate change in the future. We now have a chance to do something about that. Pennsylvania is considering becoming part of a program called the Regional Greenhouse Gas Initiative, or RGGI. Under this program, the state would place a cap on the amount of carbon pollution coming out of electric power plants. Pennsylvania is one of the top 5 worst states in the country when it comes to harmful carbon dioxide emissions. Under RGGI, power plants must pay for the dirty carbon pollution they cause. The money they pay can be used for energy efficiency and clean energy projects to create jobs. It can also help families and small businesses, including those in your community, save more money on their energy costs. We have the power, duty, and constitutional right to protect the quality of the air that we breathe. Before putting RGGI in place, the state is giving Pennsylvanians a chance to voice their opinion about the policy through a process known as public comment period. Right now, we can submit comments to support this policy that controls pollution and protects our health. The public comment period is an opportunity for our words and our stories to challenge the corporations that ignore our families and communities living with the consequences of polluting power plants. Current RGGI states have already cut carbon pollution by half. With your support, Pennsylvania can join them. Joining RGGI is good for everyone because it is part of a just transition to a stronger economy, cleaner communities, and healthier families. Join us in submitting a public comment because a unified message is a stronger message.
Hello, everyone, and thank you for joining Mom's Clean Air Force for a discussion about the Regional Greenhouse Gas Initiative, often referred to as RGGI. As you just heard from the video clip, climate change threatens the health and safety of everyone, but some populations and communities have faced more harms from pollution and climate change. And Pennsylvania has a chance to do something about this by cutting harmful air pollution through initiatives like RGGI. Our speakers today will be discussing the benefits that RGGI can provide for Pennsylvania's children, families, and environmental justice communities. Our speakers today will be discussing pollution and climate impacts from different and equally important perspectives. Dr. Frederica Perera will be talking from a science and health perspective. Laura Jacko will be talking from a mom and community member perspective. And Representative Donna Bullock will be talking from the perspective of a mom, elected official, and environmental justice advocate. Before I introduce our first speaker, I want to thank our partnering organization for helping out on this event, Sierra Club, and also the supporting organizations, Penn Environment and Clean Air Council. Now I'd like to introduce our first speaker, Dr. Frederica Perera, who comes to us from Columbia University in New York. Dr. Frederica Perera is Professor of Environmental Health Sciences and served as the Director of the Columbia Center for Children's Environmental Health from 1998 to 2018. Dr. Perera is Professor of Environmental Health Sciences and served as Director of the Columbia Center for Children's Environmental Health from 1998 through 2018. She now directs the center's Translational Research Program. Dr. Perera is internationally recognized for pioneering the field of molecular epidemiology, where she's working to understand links between environmental exposures and disease. Her areas of specialization include prevention of environmentally related developmental orders and disease in children, cancer prevention, and climate change. Her recent research is addressing the multiple impacts on children's health and development of fossil fuel combustion, both from the toxic pollutants emitted and climate change. This is all related to carbon dioxide emissions. She's the author of over 350 publications and has received numerous honors. Hello, Dr. Perera. It's an honor and pleasure to have you join us today. Hello, everyone, and thank you for joining Moms Clean Air Force for a discussion about the Regional Greenhouse Gas Initiative, often referred to as RGGI. As you just heard from the video clip, climate change threatens the health and safety of everyone, but some populations and communities have faced more harms from pollution and climate change. And Pennsylvania has a chance to do something about this by cutting harmful air pollution through initiatives like RGGI. Our speakers today will be discussing the benefits that RGGI can provide for Pennsylvania's children, families, and environmental justice communities. Our speakers today will be discussing pollution and climate impacts from different but equally important perspectives. We'll be hearing from Dr. Frederica Perera, who will be talking from a science and health perspective. Laura Jacko will be talking from a mom and community member perspective. And Representative Donna Bullock will be talking from the perspective of a mom, elected official, and environmental justice advocate. Before I introduce our first speaker, I want to thank our partnering organizations for helping to put on this event, Sierra Club, and also the supporting organizations of Penn Environment and Clean Air Council. Now I'd like to introduce our first speaker, Dr. Frederica Perera, who comes to us from Columbia University in New York. Hello, Dr. Perera. It's an honor and pleasure to have you join us today.
Well, I'm happy to be with you.
Thank you. Thank you. I want to tell you a little bit about Dr. Perera. I've been following your research for years, and here at Moms Clean Air Force, we base all of our work on science, and your research has been really instrumental in understanding the effects that air pollution and climate change can have on pregnant women and children who are vulnerable populations. Your findings certainly underscore the urgency to cut air pollution that contributes to climate change and impacts of health. This past summer, you published a very important research study in the respected scientific journal Environmental Health Perspectives titled Co-Benefits of Children's Health of the U.S. Regional Greenhouse Gas Initiative. So we wanted to talk about that a little bit today. So now I have some questions for you, Dr. Perera, that I would like to ask about the study. And first of all would be, why did you do this study? And what were the co-benefits that you talk about in the study?
Over the last 20 years now, 22 years since the Columbia Center for Children's Environmental Health was founded, my colleagues and I have done research on the health impacts of exposure to air pollution from fossil fuel burning, from transportation, from electricity generation, industrial sources, buildings, and so forth, on the health of children starting while they're in utero, and looking at that very sensitive, vulnerable period, prenatal window, and also at the early months and years of childhood. And we have seen that there are multiple impacts on children's health, on their birth outcomes, for example. We've seen links to birth size. We've seen also links to asthma, and including new cases of asthma, and also neurodevelopmental problems, including symptoms of autism, attention problems, and other issues, and reduced IQ. These are all this is all part of bad news from research, important findings, scientific findings from rigorous studies following cohorts of mothers and their babies, starting when the mothers are pregnant, and following the children on forward into childhood. And we now have, in our main study, we have adolescents and young adults. The oldest is 21 years of age. So we've been doing this for quite a while. So that's all bad news. We've also shown that stress due to poverty, environmental injustice compound the effects, and have reported that. So interactions between the toxic air pollutants and stress and stressors due to to poverty and disadvantage. Now here we had the opportunity to flip the question around and ask, when we reduce air pollution, when we reduce emissions from major sources through climate mitigation policies, for example, and thereby we're reducing not only CO2, the main driver of climate change produced by human activities, but also the toxic air pollutants that are emitted from the very same sources. We could ask, so how did children's health benefit? And we could estimate those benefits using modeling, sophisticated modeling, working with colleagues who actually developed the main model, EPA sourced model called VenMap. And we asked, what about the Climate Policy Regional Greenhouse Gas Initiative? How did that benefit health in the 9 northeastern states that participated and also in their neighboring states? And we looked at a particular pollutant, PM 2.5, particulate matter in the fine respirable range, that's been associated with these adverse health effects that we and others have reported to be connected with the exposures. So that was exciting to us to be able to show the good news and not just the bad news, put the bad news to use in showing benefits, hopefully to engage the public and policymakers and offer hope and encouragement for climate action.
And so what were some of the health benefits that you found when you did this research?
Well, we looked at health outcomes that had been associated in multiple studies with particulate matter in this fine range, and they included preterm birth, low birth weight, new cases of asthma, and autism. These were all have been shown to be likely or known to be causally related to air pollution. They're not the sole cause because no disease has just one cause, but they're established as contributors to risk of these outcomes, and they're preventable by their nature.
Very interesting. So what did you found that there was an improvement in health outcomes, and would neighboring states, would they also benefit from these reduced air pollution?
Sure. So we did consider the 9 participating states as well as the neighboring states, which would benefit from having fewer emissions in their neighbors. And so we estimated that, remember, we're not actually tracking actual changes in the incidences of these outcomes. We're using a sophisticated modeling to go from the emissions reductions to improved air quality. And then we're assessing, okay, based on the scientific literature and the knowledge about concentration response functions, how much has this policy reduced the incidence of these adverse health outcomes? We were really, I think, a bit surprised at the numbers of avoided adverse health outcomes that we estimated. Over 800 fewer cases of preterm birth and low birth weight, new cases of asthma and autism, and the associated economic savings from these avoided cases were estimated at hundreds of millions of dollars, 190 million to 350 million over the years that we looked at from 2009 and 2014. And these benefits were in addition to those that had been previously estimated by our colleagues at Abt Associates, which were 300 to 830 avoided premature adult deaths that were estimated. So these results really did demonstrate that RGGI has likely provided these substantial child health benefits and moreover, with significant economic value. However, as impressive as they are, these estimated economic benefits don't take adequate account of the long-term consequences of illness and impairment in early life. So they're really underestimates of the true benefits. But on the whole, it was very good news. I will point out a limitation, though, of the study. As you know, there's a great concern about distribution of benefits from policies like the Regional Greenhouse Gas Initiative, which is a cap and trade policy. And the concern is that the benefits are not equitably distributed due to this nature of being able to trade emissions for offsets elsewhere, other than the community that is directly experiencing the harm. And so we were very sorry that we weren't able in this particular analysis to look at that, because our air pollution data were at the county level rather than the neighborhood level. So we couldn't properly look at the distribution of benefits. And we know that those are likely to differ geographically, with some populations receiving more benefits than others. We weren't able to look across racial, ethnic, and socioeconomic groups. But we did find an exploratory analysis that the more densely populated areas tended to have more benefits because there was a larger at-risk population, more pregnant mothers, and children breathing cleaner air who benefited. So this was likely occurring in densely populated counties across the states that we considered.
So that brings up a good point, how important it is to take into consideration environmental justice areas, frontline communities, whenever you're making a rulemaking like RGGI, to make sure that there are that the needs of these communities are being addressed, and that air pollution is also being very well monitored and addressed at the same time.
That's right.
That brings up a very good point.
Well, that's very important. And this is a goal of our future studies, to be able to look more closely at this question. So we're working hard to do that with our various colleagues, and looking in some assessments at how the monies from the auctions of permits to these electric generating units and other sources, how the proceeds are allocated. Are they being allocated to benefit these communities that have suffered so much from pollution and air pollution? So that is a very important aim and goal of our work going forward, and needs to be addressed very promptly.
Yeah. Again, much needed research. So we will very much look forward to that research and love to have you back again to discuss it. And I wanted to ask, is there anything you would like to add in regards to the Regional Greenhouse Gas Initiative, air pollution, any future research that you're thinking about, or anything you'd like to add?
Sure. Well, we just published a paper, I think a week ago or a few weeks ago, just published an analysis similar to this, where we took the air quality that was seen in New York City during the COVID shutdown month. And we said to ourselves, and in this paper, we estimated, in this paper just published, we looked at the potential benefits from clean air that was seen in New York City during the COVID shutdown period, benefits to children's health. And the benefits were substantial. Now, we're not saying that we need an epidemic to clean up the air in cities like New York. We use this as an aspirational scenario, a scenario of clean air under which there would be tremendous benefits, larger than for RGGI, if this reduction in air pollution were achieved in a widespread way. We just looked at the city. It would be huge. And we use this as an aspirational scenario for other climate policies, because obviously this came from a tragic epidemic that has been so devastating, and especially to the very communities that have suffered so much from air pollution. So we are not talking about this as a benefit of COVID. We're talking about this as an aspirational scenario for climate policies to think about when, through means readily available now, such clean air levels could be achieved. And we hope that will be a further incentive to policymakers to take very strong action on climate change and emissions from fossil fuel burning generally.
Yes, I can see that. I think a lot of people did recognize the benefits of cleaner air during this period of time. And I think, or I hope that it's given a lot of our policymakers something to think about. Mm-hmm. Just like you had said, the importance of your research is to show evidence of how clean air can really benefit the climate and also health. So was there any last closing comments that you wanted to add?
I should have mentioned up front that the Regional Greenhouse Gas Initiative paper, and followed by this clean air during the COVID shutdown, they're innovative, novel in that this had not been done before, to incorporate this broader scope of health outcomes into health benefits assessments. And I very much hope that it will trigger more such assessments looking at the benefits to this particularly vulnerable group, and be an incentive to do more along these lines, because I think that we all care deeply about children and grandchildren, and we want to protect them and their future. We know how to do this. So hopefully, and I'm confident actually that this kind of data from well-conducted, rigorous research and modeling will be helpful.
Yes. So important. Thank you so much, Dr. Perera, for joining us to talk about your important research. It is so important, and we want to thank you again for spending your time with us.
Well, it's my pleasure. Thanks so much. Appreciate it.
Thank you.
Bye.
Next up, I would like to introduce our next set of speakers from Southwestern Pennsylvania. Vanessa Lynch, who's the Pennsylvania Moms Clean Air Force organizer, and Laura Jacko, who is a mom and community member. Laura Jacko is a nonprofit professional and environmental advocate who lives in Verona, Pennsylvania, with her husband, three-year-old son, and rescue dog. Her community work includes serving as president of Verona's Shade Tree Commission, being a member of the Town Parks and Recreation Board, and volunteering with Sierra Club. Welcome, Vanessa and Laura.
Thanks, Patrice, for that great introduction, and thanks to everyone for joining us and continuing to be a part of our conversation. I have Laura Jacko here with me, and we are so excited to have a really important conversation about the ways that pollution, air pollution, and climate change really are impacting regular people living near them. So, Laura, can you just tell me a little about yourself and why you personally are concerned about air pollution, and maybe a little bit about how it's impacted your family?
Absolutely. And thanks for having me. So I live in my home. I have an asthmatic husband, and I also have a little boy who's 3. I know this is the Mom's Clean Air Force, so I am sure we can all kind of relate to wanting to protect our children. And my little boy was actually born 6 weeks early. I had a normal pregnancy, no issues that would have indicated that I would have ever had a premature birth. So it was a big surprise to me. He ended up spending the first 2 weeks of his life in the NICU, which is something we were just never prepared for. And come to find out later, learning a little bit more about prematurity and how it works, especially because no one could ever tell me why it was that I had given birth so early. It turns out that a contributing factor to prematurity and premature births is actually air pollution. And I read there's quite a few scientific studies on this. Like, to me, it's very troubling, and it's always going to be a question in the back of my mind now, because I live just in the Pittsburgh area in general, which has terrible air quality, but also only 3 miles away from the last coal-fired power plant in Allegheny County. Is this anything that would have had some sort of an impact on a premature birth for me? So it's something I'm always going to have to live with, and a question I'll always have, because unfortunately you can't track one little smog particle from one smokestack into one person. But of course we can look at the trends, and I fall on the statistic. I'm now a statistic. And my little boy, of course, he, for those who aren't familiar with prematurity, the lungs are the last thing to develop. So premature infants often have lung issues and the same lung vulnerabilities. The same happened to him in the first year of his life. When he would get common colds, it was very difficult for him to get over them. We had to get a specialized machine, a nebulizer with albuterol in it, so that he could breathe properly and kick things that would have been very simple for your traditional other infants to be able to get over, which was just really awful to struggle through, frankly. And even just looking at me and my husband, between the two of us, I didn't grow up in Pittsburgh. I moved here about 10 years ago. My husband did. My lungs are fine. I've never struggled with asthma. My husband has asthma. He's got 2 inhalers and a medication that he needs to take, especially seasonally. And he's a very healthy man. He actually, grew up doing a lot of sports, sport activities, swimming, things that would traditionally be very healthy for your lungs, and still asthmatic. So it's something that we, struggle with in our home. And knowing that we have such a major polluter so close by, which I didn't find out about until after I moved here, of course, because you can't see the smokestacks quite so easily from here. Or I should say, I think they're not technically smoke, they're, emissions, but it's something that now we struggle with, and something I would like to see changed for the better around here, so that my son has a fighting chance at having a healthy life for the rest of his life.
Yeah, I totally know what you're talking about, though. My son as well, although not born prematurely, did from the very beginning have a lot of issues when he had various colds and had wheezing, and we used nebulizers for the beginning, like 7 or 8 years of his life. It can be a really scary experience when that happens to your little one.
Yeah, frankly, I was shocked that I would have to use albuterol on an infant. And maybe I shouldn't have been, because I was aware of how bad our air quality was around here. But I think when you have to live it, it's still even more shocking that you're taking this medication that is usually used for an adult. And then you have to forcefully hold down an infant and shove a little gas mask over their face, is what it looks like. And, get this chemical into their lungs so they can breathe. It's actually pretty horrifying to live through.
Yeah, I felt the same way. It was so hard to, so I was working at the time and had to leave my infant in a daycare with his albuterol. And that felt really hard to sort of leave that care of something so important and fundamental, his ability to breathe, in the hands of somebody else was even, I don't know, it just felt really intense and hard.
Oh yeah, and it's crazy. They make these kids albuterol machines. I don't know if you had one, but I think ours was like a little penguin or something. And I was thinking, it's kind of sad that so many infants are so sick that my pediatrician's office has these in stock for the kids that need them, and they they're in such demand that they already make cute ones for kids. I mean, it's nice that they had something that looked a little bit cuter for the child, but on the other hand, it's sad that that's a need.
Yeah.
Mm-hmm.
So why do you think having Pennsylvania participate in the Regional Greenhouse Gas Initiative, or RGGI, which is kind of what we've been talking about in our interviews today, so important?
Sure. So, of course, I think a lot of people hit on the climate change perspective. PA is we're kind of behind where our neighbors are, which, for me, I'm a big fan of PA. I love it here. I love my town. I love the Pittsburgh area, and I love Pennsylvania. I want to see us being on the forefront of things, moving into where we really need to be and not behind these other states that are around us. And really, it's not even a choice to me anymore. This is just believing in the science and doing our best to try and help create a livable future for our children. I'm sure many more people will be able to talk about it much more eloquently than me, but of course, that is something that I absolutely care about, more so than almost anything. It's and anybody who believes in science knows that this is just what we have to do. It's not even a choice. And that's why I actually, I personally submitted comments for RGGI testimony. I was number 5 to go. And I said these same things. It's something that is very important to me, and we all need to speak up and do our part to make sure that it's something that, PA joins on to. And I would personally like to see PA even do more. It's time for us to be a leader. And I know we can be. We are a good state. We have like 2 wonderful cities, Philadelphia and Pittsburgh. And I'm from Erie, which is another one of the bigger cities in PA. Love it there. We've got the beautiful lake and everything. It's time for us to really be a leader in these initiatives. And then, of course, for me personally, I can always speak to the pollution issues. Limiting pollution, limiting these harmful pollutants, smog, things that can trigger these asthmatic attacks, and the just these high rates of lung issues across our region is and for me, I'm speaking from the point of view of someone from the Pittsburgh region. That is, it couldn't be more important. This is people's health that we're talking about here, and it's our duty to make sure that we're protecting people's health. This air pollution is, it's not only associated with, preterm births, but, other things as well, of course, the asthma, but that creates long-term health issues as well, from, things like cancer to heart problems and things like that. It's our duty to protect our children, but, the entire population as well. And I think a lot of people kind of play off a lot of environmental issues as it's either the environment or jobs. But we have this beautiful opportunity right now to create a new economy with better paying jobs, which green jobs do tend to be better paying, safer jobs, because I don't want the people that are working in this coal-fired power plant to be around that stuff either. It's bad for them too. They're being exposed to it. When I was actually testifying in front of the DEP about it one time, I heard the coal plant manager talk about how he had a rare cancer, it was, I don't want those people around that stuff either. I want it to be good for all of our workers. I want, all Pennsylvanians to have better jobs, better paying jobs, and, better healthcare outcomes, and keep a safer place and a more sustainable future for everybody. It's really win-win-win. And to me, it's just a no-brainer that this absolutely must be passed.
Yeah, well, you touch on some really important and impactful things that are going on in Pennsylvania. I know Pennsylvanians are always very excited and supportive about the state that we live in, but I know from personal experience, the area that I live in has had major landslides and flooding issues over the last couple of years, all related to climate change. And many of my neighbors have come down with Lyme disease, their children, having extended issues that went beyond just sort of the initial diagnosis to sort of major joint issues and other related things because of the tick population. So these aren't things that sort of maybe could happen or maybe might happen in the future, but really are things I feel like are a part of our lived experience right now.
Absolutely. It's funny, I grew up in Erie, which is, if you're from there, a little infamous for their tick situation. We just have a lot of deer with the state park that's up there. It's okay. And I had never pulled a tick off of myself until I moved to Pittsburgh. And in this last year, just this fall, I had one on me and one on my child that I pulled off. I was like, what is this? It was... Oh, they're awful too. But, it was just such a weird, I've never had to deal with it because we were always, I'm careful. Like I walk in the woods a lot, but we're still careful. And it's still an issue for us. Multiple people on my block have had Lyme disease. The person that used to own my home had Lyme disease. Friends of mine have had it. My dog was exposed to it. They did some sort of a test on my dog where they can see if they had like Lyme antibodies, it's bananas. It's everywhere. Yeah.
Yeah. And I thought your comments about pollution were really interesting too. We really talk about sort of how to view moving forward into a future that really sort of reimagines how we consider getting our energy and power. And the Regional Greenhouse Gas Initiative is really a very important part of that conversation and moving us in a direction that incentivizes cleaner energy and take action to clean up air pollution and impacts of health on health and the environment.
Sure. So I can only speak for myself personally and the experience that I have lived and my truth. But I think that, for me, I found that it oftentimes feels like one person doesn't have a lot of power, but when you really look into it, every single person and every single parent has enormous amounts of power. And you don't even really need to do a whole lot, honestly. You just need to speak up and get involved. When there's opportunities like submitting comments during the open comment period for regarding joining RGGI, the Regional Greenhouse Gas Initiative, sign up and comment. It took me 5 minutes. I have a 3-year-old. Before I got on the call with you, he was literally running around naked as we were chasing him, trying to put underpants on him. You can still do it, especially with Zoom. It takes 5 minutes. You can call or email or write to the senators and representatives that need to hear that constituents support these programs. The more they hear from people, the better. You can get language from places like Moms Clean Air Force or the Sierra Club. It's like right on our websites. It's right on, and just, I mentioned the Sierra Club because I volunteer with the Sierra Club as well. But it's like a lot of these things are right in the emails, right on the websites. It doesn't really take too much time to go through and let your senators and your representatives know time and space you have for it. So I would encourage anybody and everybody, put in those comments, call those legislators. I've called the legislators. They're not mean. I've met with them. Like their staffers are usually really nice, and it takes like 2 seconds. You just call up and you say, hi, I want to make a comment. And you just make your comment and then you go away. It's, it couldn't be any easier, I promise.
Yeah, that's great. So submitting comments during this open comment period for the Regional Greenhouse Gas Initiative, signing on to a petition. These are all great ways to get involved. And for anyone who wants to be even more involved with that, Moms Clean Air Force is always happy to take our members to the offices of state representatives and senators to talk about your stories. Really, in the end, the most powerful conversation you can have is the one that's yours. It's the one that really tells the story of why you care about these things, why they're important to you, and how you're being impacted. And we love to help people get those stories to their legislature so that we can really make some positive impacts and growth and progress in Pennsylvania.
Absolutely. And I think that everybody like gets this feeling, or maybe not everybody, but I've found this sentiment out there that people feel like, what can I do? You know, when I'm up against a big company, what can one person do? I'm no Aaron Brockovich or whatever, but I have truly found in my granular local level up to like the state level, when even if you don't think that your legislators care about what you have to say, they do care about the pressure. So each person that puts on the pressure a little bit more, the more pressure that's there, the better. You know, so even if you're very jaded and you think I'm only one person or nobody cares to think about what I have to say when they've got, you know, big companies or whatever, the pressure still matters and it does change things. So you have a voice, make it be heard. Even if you're a little bit nervous, if you're like, I have a friend who's really not good at the phone, write a letter, write an email, you know, it's okay. You don't have to be good at anything, any one particular thing. Just find the thing that you feel comfortable doing and do that. Letters to the editor, you know, I've done those before too. There's so many different things, and all of the pressure from the public, it really, really matters. I promise.
It does. Thank you so much, Laura, for being willing to do this interview and being so candid about the things that you and your family have experienced. It really is remarkable to have you with us today.
Oh, well, thanks, Vanessa. Thanks for being a mom who's also fighting to, you know, keep our communities healthy for our kids. I really appreciate that. It was nice to talk to you.
You too. So now, for our final conversation, we will be having our program manager for Moms Clean Air Force, Molly Michael, and a conversation she's going to have with Pennsylvania State Representative Donna Bullock. Representative Bullock represents the 195th District, which includes parts of North and West Philadelphia. She is an attorney and a graduate of Temple University. And prior to serving in the State House, Representative Bullock was Special Assistant to Philadelphia City Council President Darrell Clark and the City Council Research Fellowship Director. Before her work for the city, Bullock worked at a private law firm and for Philadelphia Community Legal Services, where she formed and advised nonprofit organizations, small businesses, and community groups. Representative Bullock also serves as the chair of the Pennsylvania Black Legislative Caucus and is a member of the Climate Caucus, among many other committee appointments. She lives in the Strawberry Mansion neighborhood of Philadelphia with her husband and 2 sons, and we are so excited to have her today and so excited to hear what she has to share with us.
Hello, everyone, and thank you, Vanessa, for that introduction. I'm really happy to be here today talking to Representative Donna Bullock, who represents the 195th District in Philadelphia. Thank you so much for joining us, Representative Bullock. It's just such a joy to be able to talk to you today about the Regional Greenhouse Gas Initiative and some other topics that we want to cover. I'm going to jump right into the questions. I know that you and I have talked a lot about environmental justice and how environmental justice communities are impacted. But I was hoping you could give me a little bit, and our audience, a little bit of context and tell us a little bit what environmental justice means to you, and how you would define it, not only for your constituents in Philadelphia, but for communities across the country.
All right. Thank you, Molly, and thanks, Vanessa, for that introduction. I think we should be careful about how we use the term environmental justice. A lot of times it's thrown out there without any context, and it's important to understand what, that context is, what it means to the communities that are impacted. So when I think about environmental justice, I first want to think about, well, what are we trying to cure? What is the justice? And that is environmental racism, environmental injustices, and those are generally policies or practices or directives that have impacted communities of color or impacted low-income communities disproportionately in a negative way, have harmed those communities, have harmed, public health, have harmed their economic success, have harmed the ability of those communities to thrive, and they're usually reinforced by some kind of governmental or industry institution. And so the leverages of power have put those communities in a position where they can't push back, where they can't say, we don't think that this policy is a good idea, or that the placement of this facility in our community would be helpful to our communities. That their voices are usually stifled by those institutions that don't allow them to have any feedback or any kind of involvement in how those policies impact their communities. And so the environmental justice comes in for me when we are able to actually correct those wrongs, when we empower those communities to have a say in the pollution that happens in their community. We empower those communities to say that a certain facility shouldn't be placed in their schools or homes or churches, that those communities are empowered to have input about their public health. And then not just having that power to have input, but there are actual actions taking place. And we see the results of that: better air quality, less lead in school buildings, or mold in school buildings, which are something that we've seen here in Philadelphia, where we see access to transportation become more equitable, access to healthcare become more equitable, because environmental justice, for me, and environmental racism and all of those environmental issues don't just involve forest and clean water, but it also involves the built environment in which communities are around. And that's usually in those urban communities. That built environment can have just as much of an impact on their public health and their ability to address pollution in their community, and have access to all of the things that other communities with privilege do have. And so oftentimes I talk about a lot of the environmental justices that happen in urban communities, because those are the really things that are important to me and important to my constituents. That for me, in a long-winded way, are some of the aspects of both environmental racism and the justice that we seek when we're trying to fix those wrongs.
Mm-hmm. And I liked what you said about how it is really, there are a lot of intersecting issues that come together when it comes to creating this environment that is so unjust for these communities, frontline communities of color, that then compound all of the other issues that unfair housing practices go into it. We could go on and on and on. And so what I wanted to ask you, we've heard earlier in this broadcast about the Regional Greenhouse Gas Initiative, which we call RGGI. And I was curious how you see Pennsylvania's participation in RGGI, how it can support environmental justice in frontline communities, and how it should support them, those being disproportionately impacted by air pollution and climate.
So I see RGGI as an opportunity. RGGI is an opportunity for us to model good environmental policy. RGGI is an opportunity for us to kind of right the ship and say, hey, if we are going to make RGGI is a big move. RGGI is a big move for our Commonwealth, and it can set the standard going forth for future generations about how we include communities of color, how we include other vulnerable frontline communities in the conversation around environmental justice, around climate change and climate justice, and how we can better engage those communities in policies that may impact them. Number one. It's also an opportunity for us to use the benefits of RGGI, and this is like the flip side of environmental justice. Not only do those communities get the bad part of environmental policy, they often don't get the benefit of the good things that we do in environmental policy. So if we are able to use the construct of RGGI to say, we're going to make sure that these communities have a say and that we do the least harm that we can do, but also make sure that the benefits of RGGI trickle down or up to these communities, that they also get to benefit from cleaner air and less pollution. They get to benefit from good, clean jobs. And if there are revenues from RGGI that we materialize, that those revenues are appropriately distributed through communities throughout the Commonwealth, and particularly to those communities who have been disproportionately impacted by past environmental justice policies. And so I think RGGI presents an opportunity for us to do that. There are a lot of ways we can, as I mentioned, by giving folks a voice, by making sure they benefit from the good things that come from RGGI, by also making sure there are investments in those communities, and perhaps lastly, making sure that we hold ourselves accountable. So I think we can use RGGI to say, let's track the good work that we are doing, and let's track, where the clean air benefits are happening, and see that those things are happening, hopefully in communities that have in the past had been negatively impacted by our environmental decisions.
Well, and I think accountability is key, right? Because for so many, really generations, so many have not been held accountable for the practices that have really brought us to this place. So enacting a policy like RGGI without ensuring that that the policy, right, is being held accountable and that policymakers are being held accountable is important. Do you see any pitfalls in a program like this, which, as we know, it's not a silver bullet, it's a big step, but it's not the only step? Do you see any pitfalls in this kind of a policy?
Well, I think already we may be heading towards one of those pitfalls, and that is education and engagement. How many folks do you know, just in your local community or circle, even heard of the term RGGI, know what we're talking about when we say RGGI? So, there have been conversations, and there's been some public comment period by our Department of Environmental Protection, but how many communities of color, how many other vulnerable frontline communities have been engaged at this point in the conversation? And what can we do to fix that going forward? I think that the state and our policy groups and the industry has a responsibility to make sure we are educating and reaching out to all of our communities in Pennsylvania, but specifically to those communities who have been left out in the past and who may be still disproportionately left out of this process and left out of these benefits. And so we educate folks now, engage them now, and continue that engagement throughout the implementation of RGGI. That will fix that particular pitfall and hopefully avoid future negative outcomes of RGGI. Because if we're not talking to those communities now and engaging them throughout the process, we may not realize how RGGI is negatively impacting those communities, if at all, because we're not talking to them. So it's important that we start engaging them and talking to them, letting them know about the benefits of RGGI so that they can start engaging now, preparing for the implementation, the opportunities for jobs, all of those things, and having a say about what the Commonwealth does with the revenues, right? How we reinvest those revenues in our Commonwealth is very important. And if we don't engage all of those communities, then I think we miss an opportunity there to really have some transformative environmental justice policy come out of the implementation of RGGI.
Mm-hmm. And right some of these historical wrongs, right, that we've been talking about. And I do know, I really think education and engagement is a huge part of this. And I think some of the complications that come along with that are just figuring out how to meet people where they are and make sure that this isn't some, we just say RGGI like it
like it's your friend next door. Reggie is complicated, right? And every time I sit down to talk about Reggie myself or write about it, I have to say, well, okay, let me do another reintroduction or primer on what Reggie is to make sure I can talk about it in a way that makes sense to me. But I also don't look like I don't know what I'm talking about. There are definitely folks out there who are more experienced on this topic than me, that are the experts in, greenhouse gas initiatives. But this particular, policy and getting involved in Reggie means so much. One, it is a regional initiative. It is happening in states all around us. It has had benefits in those states. Pennsylvania is one of the last in this region to sign on to Reggie, but the implementation of Reggie can mean so much in regards to how we address climate change in our Commonwealth, how we address air pollution. But yeah, it's complicated and it's not easy. It is a capital, market-based strategy. It is industry-based. It's driven somewhat by the industry. And so, it may feel disconnected from the everyday citizen. I feel somewhat disconnected from it. And I only talk about it because I'm a legislator and I've been exposed to it in that context. But if you're just, everyday citizen that goes to work, takes care of your family, send your children to school, takes care of your elderly loved ones, Reggie is not something that is in your vocabulary. As I mentioned, you may think it's your neighbor next door, but so how we figure out how to share this information with our neighbors, with our coworkers, with our friends and family in a way that they can understand it is very important, so that they can be best engaged to have a say in how their community participates or benefits from Reggie. And how we get there is it's part of my responsibility, others and that are in policy and advocacy groups' responsibility to figure out how we bring everybody else to a space that makes sense, so that they can have a truly valued role in this initiative. And you're right. I think a lot about meeting people where they are. When I first got involved in environmental justice issues, it was foreign to me. And Moms Clean Air Force, they were a group that came out to meet with me early on in my elected career, my political career, and said, hey, we think you should be engaged in these issues. And honestly, I hadn't worked on a lot of environmental issues before being elected. And what I knew was a few things: that I too was a mom who was concerned about the air that my children breathe, who was concerned about a child who had been exposed to lead, who was concerned about children in my neighborhood, and wanted to make sure that we all had access to clean air, wanted to make sure that our homes was not making us sick, our schools weren't making our children sick, wanted to make sure that all of those things was something that I worked on as a legislator now in this new role. And so I started to have these conversations, not in universities or in other places. I had these conversations in churches and in community centers, and we even had a mixer in a corner store just to talk about these issues that mattered. And maybe we didn't call it environmental justice or climate change or any of those terms, but definitely we understood what it meant for our communities to have clean air and not to be dumped on, and to have our schools be healthy and clean for our children. And so with Reggie, I think we need to do the same thing. We need to find a way to reach out to folks where they are and to just break it down in just common sense terms and descriptions so that folks can get on board.
Yeah, absolutely. And I think, I think about this in Philadelphia, the conversations that I've had with parents that have been the most impactful or the most meaningful to myself as an advocate and to them is when we talk about the childhood asthma rate in Philly, which is more than twice the national average. Our public schools are majority children of color, and that's where school nurses are fighting that as well, and it comes from not only indoor air quality, but poor outdoor air quality. And, you know, potentially Reggie could clean up our air to a certain degree and then provide that kind of funding, which we haven't said this yet. You know, the estimations are the tune of $300 million, right, in a year. So we do have this opportunity, and I think we can break it down. And I think that we have a long way to go to make sure that we're not just having these lofty conversations about this complicated policy with a bunch of policy wonks who speak a different language than I do, for sure. So getting right to our final question is I was curious about, you testified at the public hearing, the virtual public hearing that the DEP had a few weeks ago, and you talked about centering this policy around an environmental justice strategy. So what priorities and principles do you think should guide policymakers at the DEP and in the Wolf administration, as this is the administration that has put this proposal on the table? But what priorities and principles do you think should guide these policymakers as this proposal is finalized?
Right. Thank you for that question. And you're right. We need to figure out how to center, you know, Reggie and any of our environmental initiatives around environmental justice and environmental, other environmental causes to benefit those who have been left behind. First is equity, making sure that everyone has equitable access to the conversation, equitable access to the benefits and of the initiative, equitable access to the investments, right? And second, I would say, you know, that access and engagement and making sure people's voices are heard, which we've said earlier. It is so important to engage people, to listen to those communities. It's not enough to put together some office, but not truly listen and respond to the voices that you are, saying that you're engaging. That last for me would probably be respect, because I often think about if those communities are respected in a way that you would think of your own community, if that was where your mother lived or where your children lived, if you respected them as people who have the same rights to clean air, the same rights to clean jobs, the same rights to investments in their community as you, then you would understand the concerns of those communities, especially those who have historically been, overburdened by bad environmental justice or environmental policies. The communities who have historically carried the negative impact of bad environmental policy in industry in their communities. You know, they suffered that. For many of us to be able to have all of the joys and privileges that we have without seeing the facilities in your backyard, without seeing or dealing with water that may have been contaminated or having bad, indoor, outdoor air quality. Those communities suffered all of that for our benefit, and so, or their collective benefit. And so if we hold those principles of access and equity and respect, then we'll engage those communities in a meaningful way. We'll hopefully develop and establish policies that include them, and not only just include them, but actually take affirmative, proactive actions that better their situation. And those actions we mentioned earlier, number one and first and foremost for me is the investment. That $200 to $300 million, some meaningful portion of that revenue be designated to those communities in a way that they believe will help them. right?
They should be able to decide, right?
Right? In a way
Right,
that they believe it will help them.
Yeah.
Participatory investment, an investment in which they say, we think investment in whatever it may be, job training, subsidizing utility costs, building infrastructure in a way that that community believes will better their community. But also accountability, keeping track of what we're doing and holding ourselves accountable about how this policy benefits, or if unfortunately does not benefit certain communities, and make sure we're correcting those things sooner than later and not waiting for generations to come. And so those are some of those policies and actually actions that we can take moving forward with Reggie.
Thank you for that. And I feel like the perfect note to close on is that idea of not telling communities who are disproportionately impacted what they need, but finding out what they need and giving them access to an ability to get those fundings for that funding for the things that they need. Too often we're telling communities that we know nothing about what it is that we're going to do for them, right? So I just think that that's such a really strong point to close on. I think it's important. I think a lot of us forget it. A lot of us who are not people of color will forget it first. And
a lot of folks who think we mean well,
yes.
We mean well, nice, well-intended folks who want to believe that they can do something here. And I appreciate that. And I think most people do, even myself. But I also understand that the most valued voice here are the communities that are being harmed, or that have been harmed in the past. And this is a time when we should give them the stage. And when we say centered, a policy that will be centered around the environmental justice, a policy that's centered around these frontline communities, truly centered, will give them the stage and let them talk, give them the tools and the resources so that they can direct the future for their communities.
Yeah, that's absolutely important. Thank you so much. And thank you for your time, and thank you for your engagement on this issue and for representing your constituents in Philly so well. I really appreciate it. And I'm just going to close by telling everyone watching that if you would like to make a public comment on the Regional Greenhouse Gas Initiative, the public comment period closes January 14th. At the end of this broadcast, you're going to see a slide that will give you a link to tell you where to go to make public comment very easily with just a couple of clicks and make your voice heard. Thank you again, Representative Bullock, and have a happy New Year. Here's to great things in 2021. And there's so much work to do, and appreciate that you're here with us in the fight, from one mom to another. Thank you so much.